The following segment is paid for by Preventative Diagnostic Center.
It's no secret, as we age, many changes take place in our body. And if any of those changes involve illness or serious illness, we want to know about those changes way ahead of time. Dr. John Pierce is here from Preventative Diagnostic Center to talk about the amazing CT scan he has and what it can detect. Doctor, welcome back. What can it detect?
Oh, geez, there's a whole plethora and range of different maladies that we can detect. Starting from the thyroid, we can see nodules there that may need follow-up with ultrasound. We can see an enlarged thyroid. We go a little further south. When we get into the chest, we can see nodules in the lungs from previous infections or, God forbid, a lung cancer. And hopefully we catch it early enough to allow for therapy and treatment. And then we can also see pneumonias, and we've seen effects from COVID in the lungs. We're able to see into the heart. We're able to look at the coronary arteries and see if there's any coronary artery disease of significance. We're able to look at the kidneys and see if there's kidney stones and cysts or other concerns of the kidneys, the pancreas, the liver. We're able to see all of those organs through the intestines, right on down to the gonads. So in women, we can actually see if there's some tumors of the ovaries. We're able to see in enlarged prostates or potentially a prostate cancer, but it would have to be pretty big for us to see that. And that would almost be in an advanced stage. So we're able to see a lot of things that would otherwise not show any signs or symptoms or lab abnormalities until it's almost too late. So we're able to see things real early in the process.
I mean, it's just incredible how many conditions you just listed. And so what we're talking about is a scan that is potentially from the chin to the groin and everything in between. It's really amazing. I've been down to Preventative Diagnostic Center. The scan itself is so easy. It's amazing. It's that profound. And then can you explain to me a little bit about your team there and what the follow-up is after the scan?
Well, as you know, we do the scan. It takes 30 seconds to a minute to do the scan. You're not enclosed into anything. It's almost like going through like a thin donut almost. So you're not there long and you're not enclosed. We haven't had anybody run away because of claustrophobia. So that's very, very good. We send that scan to a board certified radiologist who reads it, and then we get the report back. Now, if there are abnormalities on the report, myself or another healthcare provider will call and discuss follow-up options that the patient would need to do. Otherwise, in most cases, fortunately, most people don't have anything of significance that needs medical follow-up, and we'll send those reports right directly to them.
Yeah, and we hope not to hear from you. No offense, Dr. Pierce.
No, absolutely. I don't like making those calls.
I know, I'm sure you don't, but you know what? Early detection is key, and it's so important. You're helping people get the information they need. You're really empowering people to understand what is going on with their body. So it's very, very important. Who qualifies for the scan? Now, when I went and got it, I was able to come down and partake. Sean was actually turned away because he was still in his 30s. And frankly, you recommend it for people over 40, correct?
Yeah, 40 to 75 or 80, and it really depends on the overall health of the individual. And if somebody was 80 and very good health, we would do the scan. But we want to make sure, first off, primarily with females, that they're not pregnant. So we don't want to expose a fetus to radiation if that was unnecessary. So that's why we kind of set that limit at 40. And yes, women can get pregnant after 40. But we do talk to them about the potential of pregnancy, and we prefer, to them to have a negative pregnancy test before we did the scan.
Speaking with radiation, that might be something that is stopping some people from coming in. This machine that you have, there's not another one like it between here and Northern California. It has very low radiation.
Yeah, so the machine actually measures the individual and gives the lowest effective dose of radiation to give us the highest quality images for our radiologist to read. Other CT scans don't do that, and they just kind of give this standardized dose of radiation. So we're going to try to minimize the exposure as much as possible.
All right. It's called Preventative Diagnostic Center. You have a special offer today that is pretty unbelievable. This is a serious discount. You've been coming on the show for a while. I can see this is a serious discount. I don't suspect this is going to last very long.
You never know. That's all up to the owners, and that's out of my hands. That's above my pay grade. However, that special is 2 heart scans for $125. So one individual doesn't need 2 scans. So bring somebody with you, a spouse or significant other or real good friend. We don't care. Just bring someone with you and get 2 scans for $125. Typically, they're $599 per scan.
All right, Dr. John Pierce, John J.J. Pierce, that is, over at Preventative Diagnostic Centers. Folks, you may have seen them from the 215. They're located on South Tenaya Way. You can check them out on Facebook as well and look for them on their website, their phone number.